Дорогие друзья, мы вернулись обратно. We are back, and our next speaker is English speaking, so we are very happy to welcome Dr. Jama Nateqi. Jama is the co-founder of Symptoma, which is the digital health assistant. And today, Doctor will be speaking about transforming today's medicine into precision medicine via artificial intelligence. Jama, we are very happy that you're with us, and please start.
Thanks for having me. As I said, my name is Jama. I am a medical doctor and co-founder of Symptoma, and Symptoma is a digital health assistant. Our vision: every patient deserves the right diagnosis and treatment. And why is this important? Well, let me introduce to you a boy at the age of 3 with the name Isaac. Back then, Isaac was rather shy and had a loving personality, but one day Isaac just started grunting at his peers and friends in kindergarten for no apparent reasons. At first, his parents thought it's just part of the normal child development, but then Isaac also started screaming for hours, as if in severe pain. When he wasn't screaming, he just stared vacantly into space. Isaac became depressive and suicidal at the age of 5. Terrifying thoughts of death plagued him. Whenever the word death came into his head, he would smash his head into windows and walls in order to drown out his thoughts. He couldn't go to the bathroom alone anymore because of the voices he heard in his head and the things he saw. Fears became immense and paralyzing. Over a course of 4 years, 100 doctor visits and a host of misdiagnoses and mistreatments, his parents tried to make peace with the idea that their son might never come back again. 1 in 7 diagnoses are misdiagnoses, and each year, 1.5 million lives could be saved with the right diagnosis. But what causes misdiagnosis? It's misinformation. Physicians have to consider way more than 20,000 diseases at once, more than a single human being can handle, even a doctor. So what can we do about it? The medical knowledge has already been published, but it's really hard to retrieve the right information in a timely manner. And there are already great approaches out there. So companies have tried since the 1970s to establish so-called symptom checkers. However, the databases are by far too small in order to provide any sufficient accuracy. So no help here either. We have developed Symptoma, a digital health assistant. Patients and doctors enter their symptoms, and they receive a list of matching causes sorted by probability. And the real magic now actually happens in the chatbot. So we have here entered on the top left 3 symptoms that Isaac had, the boy from the beginning. So he had grunting, screaming, and death anxiety. And then you see the AI behind Symptoma asking the right questions in order to uncover further symptoms that you might have. And on average, every 3rd question is uncovering another symptom that hasn't been entered before, but which is the case. In this case, it was the notable agitation. It is also working with free text input. So if you just enter, I have to frequently urinate, it's asking for painful urination. And it is even working with keywords that are no symptoms at all. In this case, if you enter undercooked eggs, it understands the relevance that you might have abdominal pain and nausea, and that salmonella food poisoning might be the underlying cause. This is actually one of the biggest novelties in the market, because usually a symptom checker requires you to choose from a list of given symptoms. Sometimes they have hundreds of symptoms in the database, sometimes a few thousand, but you have to choose. If you enter something that they do not have in the database, they cannot show you the underlying results. Even fun searches are possible. In this case, if you enter Elon Musk, the system is asking you for manic behavior, probably also right. We have invested 15 years in research and development, and so far established the probably biggest disease database in the world with 20,000 conditions and billions of connections to symptoms, risk factors, and statistics. And this is leading to the by far highest accuracy rates in the industry, which has been demonstrated in internal, external, and peer-reviewed studies, and even confirmed by our competitors. This is from a study which is based on the methodology that was published by Harvard University scientists in 2015. And a noteworthy study probably is also been contracted by Pfizer. They have compared 107 solutions worldwide, concluding Symptoma to be the by far best solution based on the operational nature, but also regarding its diagnostic accuracy. For COVID-19, we also have our accuracy peer-reviewed in a Nature journal. And in this journal, Journal of Medical Informatics, we actually compared the accuracy of, there were so many symptom checkers for COVID-19 alone, and we compared their accuracy. And essentially, we compared the accuracy of 12 solutions. And you see that not only 12 doctors will have 12 different opinions, but even 12 symptom checkers. And so it's really important to actually look at the clinical or at the evaluation and the quality assurance of each symptom checker. In this case, what you find here is that 2 symptom checkers were wrongly classifying COVID-19 patients as not having any risk for COVID-19. And so thus they were overlooking 60% of the COVID-19 patients, or even 90% in one case. And one of the reasons, and all of those solutions were at the time of testing binary. So they were only checking for COVID-19 symptoms. They were not asking you for any other symptoms that you might have. And they were also only looking at a match regarding COVID-19 and not any other disease. Whereas Symptoma on the top right was differentiating COVID-19 from more than 20,000 possible diseases and also allowing any other symptom to be entered. And thus, on the right side, you see one of the crucial factors of Symptoma's accuracy, which is the capacity to be able to process, in this case, 100% of the patient data in order to score the risk for COVID-19, for instance. As I said, we are out here since 15 years, and we have never really focused on marketing, but on technology and on cash flow. But we are receiving more and more recognition from the experts in the industry and the European Commission. We have been invited to speak in the European Parliament and also in the German Parliament, and also received recently awards from the Austrian government regarding our fight against COVID-19, for instance, where we served more than 100 million citizens in 36 different languages in 100 countries. Which also led to the award of Austrian of the Year for the research at Symptoma. But the question rather is how this can help patients like Isaac. Back then, his parents, by luck and chance alone, came across a crucial piece of information that his symptoms match a disease called PANDAS. And PANDAS is a rare autoimmune disorder. The treatment, a simple antibiotic. The results dramatic because within the next day, his fears vanished and he smiled again for the first time in nearly 4 years. And within a few weeks, all his other symptoms just faded away. It was this little crucial piece of information missing in order to get the right treatment and thus also the cure. And he's yet one of the lucky ones because millions of patients do not have this luck, this little piece of information yet. And this is what we are fighting for at Symptoma. Examples on how this can be, this is being also used in the clinical context, as for instance, in waiting rooms of hospitals and doctor offices, in order to have the assessment of the patient and then provide the doctor with a more standardized way in a second opinion on which diseases are must not misdiagnoses that you shouldn't miss, obviously. And also pointing to possible rare diseases that might be the case. Of course, also showing the most common diseases. It can also be utilized for specific use cases for single or a couple of diseases only. The Austrian government, for instance, in this case here, the city of Vienna, utilized Symptoma in order to help patients assess their COVID-19 risk themselves in order to then, if the risk was high, to offer them PCR test, sometimes even at home. And this was quite crucial because first of all, the adoption rate was really high. Second of all, normally, especially in Austria, for digital health solutions that are widely publicized, you always look also regarding data privacy. In our case, we don't store even IP addresses. We don't place third-party cookies. We don't ask for your name. We don't gather data that could be personal. However, we just do the assessment, and then the citizen has the choice to themselves at the website of the government, then actually to enter personal data in order to get the test, for instance, at home. A third factor to consider here, which is needed for the future of medicine, is that we had so much learning because we are getting feedback loops. So our session IDs were then coupled with the diagnostic test results. And we were able to actually demonstrate and show how the symptom occurrence frequency rates for COVID-19 really were. For instance, the myth that a runny nose or a sneeze is a deciding factor whether you have or have not COVID-19 was rather false, because the patients that the chatbot has seen, at least for that, it was insignificant. But however, we learned new symptoms that are more prevalent with COVID-19. And also what we learned is that over time, the symptoms changed, probably due to the mutations that were more prevalent. So in this case, it actually helped to, in a standardized way, actually to gather real-world data that you can thereafter turn into real-world evidence, and gain a better understanding of diseases, and so that you later on can actually tailor the drugs better to your diseases. And this is what we're here for. Essentially, precision medicine means for us that we can then eliminate the guesswork from medicine so that we have a data-driven decision making. That's it. If you have any questions, I'm happy to answer. Thanks.
Yes, Jama, thank you. Thank you very much. I actually have a lot of questions, maybe because it's my first acquaintance with a system like that. And I would like to ask, so I understand that it's already being used somewhere.
Yeah.
In Austria, I presume? Can you tell me about it?
Yeah, so it's available in 36 different languages in 100 countries. It's been used by 10 million users a month. So we have real-world data from hundreds of millions of sessions.
Wow, 10 million users, that's a lot. And I understand that that's a patient-oriented system. So the patient interacts with the system and the system tells the diagnosis. And what happens next? Like the patient comes with this suggestion to the doctor, or what kind of track?
Yeah, so it's been used by patients and doctors alike. So due to the free text input that we make available, it really depends on how you enter your symptoms and how you word them. So it's really like Google. So you can, if you're looking into a specific topic and you're a layperson, you're probably using layperson's wording, and you're getting the results that are rather tailored to your to your expertise level. Whereas a doctor would search more specifically. They would name the symptoms differently. And so it is available for both. And our chatbot then helps patients, based on the free text input, to actually, by the questions that we ask, to uncover further symptoms in a standardized way, so that we really are sure that, okay, it's not this general symptom, but a specific form of the symptom, or there are other symptoms as well that the patient forgot to actually enter. What then happens is we are not delivering the diagnosis, but we are showing the probabilities of many different diagnoses or many different diseases for our case. You have to be aware of that 10% of the population has a rare disease, whereas only only 25% of them actually have the diagnosis. And even they had to wait 10 years from symptom to diagnosis on average. So you have in the European Union, 30 million citizens affected by rare disease, but 22 million citizens don't have the diagnosis yet. So they're searching, they're running from one doctor to the other. They want to understand on what it is that is explaining their symptoms. And so it is rather as a second opinion, and also for doctors, it is really as a second opinion in order to understand, am I overlooking something? So the common diseases are the most common, yes, but there are diseases that you must not miss, like such as ectopic pregnancy, that if the patient could die, and also rare diseases, and they are far more common than we think. And in the long term, it really helps to generate real-world data to better understand the diseases and to have a more objective approach in diagnosing patients and delivering the same standard of care with every doctor that is using the system.
Mm-hmm. And also today we talked a lot about the loss, because some products that are produced for healthcare, they have to be registered in a special way. Could you tell more about registering a product like this one, like about the communication with the loss?
Yeah, of course. So Symptoma's digital health assistant is certified as medical device class 1 in the European Union. And also, let me give you one example. So for COVID-19, our chatbot was ready in January 2020. But before we communicated, we first did a study ourselves that we then submitted for peer review to Nature, and they published it in March. So in March, we did the study and then communicated that our system can be used also for COVID-19. So I think it is really important to also support your technology, especially in the digital health arena, with scientific data and with the transparency, not to say, we're testing a lot. No, you have to show it. You have to show the cases. You have to be able to demonstrate it also with external confirmation. Mm-hmm. And this is just a normal part of regulations, and it should be normal in digital health as well.
So do you think in the future some part of the doctors' work will be replaced by assistants like that? For example, now we have a lot of patients that come into the hospital, and this simple job of taking the symptoms and presuming diagnosis and just trying to understand where the patient has to go. I think this just could be done by systems like that. But also, what are the dangers of using such systems? Do we have to be careful?
Yeah, so first of all, there are different kinds of artificial intelligence. So one kind is narrow AI, so-called. Mm-hmm. And the other kind is general AI. The narrow AI is analysis and interpretation of radiology images, right? So there you need the data model, or the learning models are available. I mean, it's not rocket science anymore. However, what you need is a lot of data, which is annotated. So it's really about having the data. And so narrow AI is really easy to apply, and it has a really good market adoption as well, and for a very good reason. Where we are placed is general AI, because there's so many different ways a patient can voice their concerns and their symptoms, and you will all need a human being in order to help to translate for the machine at some point. Of course, a lot can be done by our AI also in the future, and in systems like this. However, you also need another component, because also for the healing process, it is about trust. It is about being listened to. This alone also already has a curative effect. So I don't think that you can replace doctors like that. However, I think that a doctor in 10 years from now that is not using an AI, such a symptom of, for the well-being of their patient is going to be confronted with malpractice claims, because the technology is there. It is going to be impossible to differentiate so many different diseases in their various forms, and you will need to compute a lot of data. And this is just the domain of artificial intelligence and not the domain of the human mind. And so AI is going to be used as a tool in order to augment the doctor's capacities.
Mm-hmm. Yeah, so maybe we could spend more time with the patient, caring about his feelings and psychological comfort and stuff like that, and the healing process, and maybe leave some technical, simple things to the machines. Sure. Okay, so Jama, I think I don't have any more questions. So thank you so much.
Thanks.
We are really. Oh no, wait. We have one more question. Don't go away yet. So the question is written in Russian, so I'll try to translate it. The question is from a student of Skoltech. It's a very good university here in Russia. And they would like to know your opinion on the ad for, just one second. So apparently they have some kind of ad for recognition and imitation of emotions in children with some kind of disease. And I'll translate the name of the disease. Give me a minute. And they want to know if you think that would be a good idea for this field. Did that make any sense?
Yeah, it makes sense. So okay. There's a lot of technology that via face recognition is identifying patterns for rare genetic diseases mostly. And why this is a really interesting approach.
Yeah, apparently we are talking about autism. Yeah, that's it.
Autism, okay.
Yeah.
And okay, so about the emotions and how they react. Yeah, so this is now a really good question, because it can go both ways. It can go to a dystopian world and a utopian world. In the dystopian world, everyone is being monitored like that for health reasons, but you can use it also for other purposes. And so I think that the patient's sovereignty and patient's privacy is paramount. We cannot compromise here. So what we are doing is we are always finding ways on how to protect the sovereignty of the patient and still deliver the healthcare needed. So there you're talking mostly about decentralized AI, for instance. And and I think it is a really crucial topic. And especially in Europe, we have to be successful with that, because otherwise millions or even billions of citizens are going to compromise their data privacy and sovereignty for a better health. And I think long term this will have too much potential for misuse. And so I would advocate to take care of the patient sovereignty, deliver the healthcare, but in a way that supports the sovereignty of the patient.
Yeah. Okay, so thank you very much. It was very interesting to get to know about Symptoma, and we really look forward to using systems like that in our practice. So thank you so much.
Thanks.